Hello viewers, this is Flames TV. Today, we want to talk deeply about a health-related topic that is currently a health death threat in the European, American, and British countries. This topic involves a health disease called diabetes. Diabetes is a deadly disease that, if not well managed, could cause the life of the carrier. Now let's go into the topic properly: diabetes in European, American, and British regions. Diabetes. This is a disease that results in too much sugar or glucose in the blood, that is high blood glucose. Diabetes is a condition that happens when one blood sugar, glucose, is too high. It develops when the pancreas in the body doesn't produce enough insulin or any of it at all. Diabetes affects people of all ages. Most types of diabetes are chronic, and all forms are manageable with medications or lifestyle changes. Mind you, glucose, sugar, mainly comes from carbohydrates in the food and drinks we take, which serves as the body's source of energy. Now the blood carries this glucose to all parts of the body cells to use for energy. When this glucose flows through the bloodstream, it needs the help of insulin to get to the various parts of the cells in the body that need it for energy to do its work. If the pancreas is not producing enough insulin or the body is not using it properly, the glucose builds up in the bloodstream, causing high blood sugar, hyperglycemia. From time to time, having consistently high blood glucose can cause health problems, such as heart disease, nerve damage, and eye problems. Diabetes can also be technically called diabetes mellitus, DM. Now diabetes can lead to heart diseases, such as heart attack, high blood pressure, and so on. When one is diabetic and the condition is not well managed, from time to time, the high blood sugar can damage the blood vessels and the nerves that control the heart. These damages lead to heart diseases, causing the heart to dysfunction, leading to complications at the heart region. The longer one has diabetes, the higher the chances of developing heart disease and over time heart failure. So therefore, diabetes mellitus is associated with various cardiovascular complications, including sudden cardiac arrest, high blood pressure, myocardial infarction, etc. Types of diabetes in European, American, and British countries. There are several types of diabetes mellitus. This ill health condition is common in the European, American, and British regions. The most common forms include Type 1 diabetes. This type of diabetes is an autoimmune disease in which the immune system naturally attacks and destroys insulin-producing cells in the pancreas for unknown reasons. Up to 30% of people who have diabetes have type 1 diabetes. That is to say that this type of diabetes often occurs naturally, which means it can be genetically transferred from parents to their offspring. Type 1 diabetes is usually diagnosed in children and young adults, but it can develop at any age. Type 2 diabetes. In this type of diabetes, the body doesn't produce enough insulin or the body cells does not respond normally to insulin resistance. This is the most common type of diabetes that mainly affects adults, though children can have it as well. Gestational diabetes. This type of diabetes often occurs in some women, especially during pregnancy. Gestational diabetes usually goes away after pregnancy. However, if one has gestational diabetes, there is a higher risk of developing type 2 diabetes later in life or in future. Prediabetes. This type is the stage before type 2 diabetes. The blood glucose levels are higher than normal, but not high enough to be officially diagnosed with type 2 diabetes. Other types of diabetes include type 3C diabetes. This type of diabetes happens when the pancreas experiences damage, which affects its ability to produce insulin. Note that pancreatitis, pancreatic cancer, cystic fibrosis and hemochromatosis can all lead to pancreas damage that causes diabetes. Also, having your pancreas removed, pancreatectomy, also results in type 3 diabetes. Latent autoimmune diabetes in adults, LADA here. Just like type 1 diabetes, latent autoimmune diabetes in adults also results from an autoimmune reaction, but it develops much more slowly than type 1. People diagnosed with latent autoimmune diabetes in adults are usually over the age of 30. Maturity onset diabetes of the young, MODY. Maturity onset diabetes of the young, also called monogenic diabetes, occurs due to an inherited genetic mutation that affects how the body makes and uses insulin. It is recorded that there are currently over 12 different types of maturity onset diabetes of the young, and it affects up to 6% of people with diabetes and commonly runs in families. Neonatal diabetes. This is a rare form of diabetes that occurs within the first 6 months of life. It is also a type of monogenic diabetes. About 50% of babies with neonatal diabetes have the lifelong form called permanent neonatal diabetes mellitus. For the other half, the condition disappears within a few months from onset, but it can come back later in life. This is called transient neonatal diabetes mellitus. Brittle diabetes. Brittle diabetes is a form of type 1 diabetes that is marked by frequent and severe stages of high and low blood sugar levels. This unstable stages often leads to hospitalization. In rare cases, a pancreas transplant may be necessary to permanently treat brittle diabetes. That's all for the first phase of this health-related lecture topic. Kindly stay tuned for the next second phase video. Please do well to like, subscribe and comment on our YouTube channel, and hit the notification bell to notify you for more important health-related lecture. Gracias.